Hi, Dr. Constance Scharf here, and we have great news to report today. A few hours ago, the president has declared a national emergency regarding the opioid overdose crisis in this country. Every day, 142 Americans on average are dying of accidental overdoses, and we've never seen anything like this before. What a national emergency does, the declaration, is it frees up a whole bunch of money to be used to address the problem. So what does that mean now? Well, usually the money is allocated to the states, and the states can do different things with it. You'll see, I would imagine, money that is given to first responders, police officers, firefighters, lifeguards, Coast Guard even, people who are on the scene, and you're going to see more naloxone, which is the opioid overdose reversal drug, in the hands of those first responders, which is wonderful news because that will immediately begin to save lives and to decrease the death toll that's associated with accidental overdose. And the second thing that we're hoping, at least, is that we'll see money allocated in particular to low-income treatment beds, essentially to Medicaid beds. But we don't know what that'll look like or how that money will be allocated. So what I would encourage you to do, if this is an issue that is close to your heart, if you have someone that you know needs treatment or have lost a loved one to overdose, is right now is the time to call your national level representatives in both the House and the Senate, and also your governor, and let them know that you want to see that money allocated as much as possible to your state and where you want to see that money allocated. Primarily, in my opinion, it should go to first responders and also to increase the number of treatment beds available. Because especially low-income individuals, and we know that's where a lot of addicts fall, right? Most drug addicts don't have wonderful full-time jobs. We want to see those individuals have access to quality treatment of sufficient duration to give them a real chance to get better. Now, this new change does not address problems with healthcare and the way insurance companies work, or the changes that are expected to the funding of Medicaid. Because if Medicaid becomes block grant funded, we can actually see the expansion of Medicaid retract, which would, in the long run, mean less addiction treatment available to those who have a low income. So good news today for those who have an addiction treatment problem, but we have to act, and now is the time to call your representatives. If you are struggling with addiction or you know someone who is, get them treatment now. Every time they use, it is an opportunity for overdose and death. Have a good day and take care.